Hello and welcome to Differential Discussions. I'm Melissa,
I'm Dave.
and today we're going to look at a slide of ALL with eosinophilia.
This one is weird.
This one is weird. So this one, the patient presented with eosinophilia, but no blasts in the peripheral blood. And so once they had a bone marrow, that's when they realized, oh wow, there's a lot of blasts in the bone marrow, but in the peripheral blood, for a while, there was no blasts, just the eosinophilia. So this is basically that, just
Yeah.
the eosinophilia.
So yeah, this is kind of a neat thing. I think should be interesting to students, but even but I would say like bench people can kind of learn a lot here, right? Because one might just kind of see a bunch of eosinophils and I mean, my mind goes to like allergic reactions, more benign sort of conditions. So this is good to kind of put it out into the ether here. Um,
Yep.
you can
Yeah,
get
so it's not unheard of to have eosinophilia with an ALL. It's
yeah.
rare, but it's not unheard of. Uh, Essentially, there's going to be specific cytokines that are secreted, and they cause eosinophilia. The details, I
Yeah.
think that's still being discovered and worked out, but we do know that there's something being secreted stimulating the eosinophils. The eosinophils are not malignant.
Yeah. Yeah. So these
The
are normally functioning
Yes,
cells. Yep.
there's
Very
just an
important.
abnormal number of them because of the stimulation to keep producing them.
Yep. 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 So pretty fascinating. So yeah, looking at the low power here, looks like a couple of neutrophils in center field, and then we get some EOs hanging out on top, maybe. Yep.
So a couple neutrophils and then
Mm.
EOs.
And I'm looking at like the platelet count, and I wouldn't do an estimate right here, right? And especially with this format, but like there's platelets, so that's good.
Yep.
Um, maybe a little bit of anemia. I see some hypochromia, but nothing too crazy. So I think that what I find most fascinating about this is like I might look at this slide and not even really be
Yeah.
thinking anything crazy. So
Yeah. Yeah.
I'm interested.
Absolutely. I
See.
mean the hypochromia. I mean this is the a teenage girl, so you are not going to be surprised by seeing hypochromia.
Nope.
Maybe
Yep.
thinking that there could be microcytosis because well she's probably iron deficient,
Yep.
so that wouldn't be surprising. And the eosinophilia, we might just think
100%. Like the first place I go is just allergic, some kind of a reactive
yeah,
process.
let
All
me
right.
look around a little bit more
Yeah, sure.
on
Yeah.
this 40x.
Do our due diligence, see if we see any crazy things. We're going to pretend we're blind here, right? We kind of have an idea of what we're going to see on the slide, but we want to look at this with fresh eyes.
Go a little bit deeper.
Sure. Yeah, so Melissa's using a trick to go a little on the thick side, right? Just so you can see more stuff.
Yeah, frequently it's going to have more cells. You see less detail, but more cells.
Looks like there's a baso in the field. I'm just guessing. And then there's a mononuclear cell at the top.
Or that
Uh,
one.
that one. That's the one I think, but I don't.
Looks like it.
You shouldn't be doing diffs at this magnification, Dave.
Yeah, I mean, it just looks. Let's go to the feathered edge too, because those
Hmm.
really large mononuclear cells a lot of times get pushed to the feathered edge. So let's just go take a peek.
That's wisdom. Yes.
Hmm. Just more neutrophils and EOs, really.
Yeah. The occasional lymph too. I'm
Yeah.
actually excited to see what some of the lymph morphology might look like. Uh,
I didn't even see that many lymphocytes, so
No, there's not a ton, but
yeah, there's not a whole lot here. Just these. Oh, there's a little platelet clump there. But yeah, nothing too exciting here.
mhm.
All right, let's go back. You ready to go down to oil?
I think so, yeah.
Let's start here.
Hmm. So yeah, I think you saw one hypogranular EO, and this one's not too bad, but like it's not full of granules.
Yeah, and it's because you can see the cytoplasm, right? So you can
Yes.
see the cytoplasm behind the granules, which we don't normally see. We just usually see granules everywhere.
Hmm.
I think we've said this before, but really the cytoplasm has no real coloration to it when you remove the granules for all of our granulocytes.
Hmm.
So here it's really showcasing that with our hypogranular EOs.
Yep. Yep. And our platelets look pretty normal.
Yeah, they're actually not bad.
Yeah. That's a I must admit, I mean, platelets are like a huge signal for me when it comes to leukemias. That's
Yeah.
or the lack thereof, I should say. Whoa, cool.
Wow.
Is this a baso?
No, those granules are too small.
So something weird's going on here.
Yeah,
Does that
I think
does
it's
that nucleus look connected, or is this just a poly?
yeah. I'm wondering if those are eosinophil granules in there. They don't look big enough though.
Not to me. The ones that I want to try to tease out are those darker granules.
No, I
I don't
know, but there's a certain cell that you can see sometimes in leukemia that has both eosinophil and basophil granules. Yeah, I was wondering if it's that, but I don't think it is. And I think all the granules are a little bit too small. Maybe it's just some kind of toxic granulation.
I guess so. Very odd though. Um, I, what's striking me here is I've seen a lot of cells. This is very strange.
Very strange. Yeah, and I can't tell if the nucleus is completely
Mm,
intact or if it's broken. I think it because where I'm questioning is if it's intact
yeah,
here.
yeah, that's
Definitely intact
exactly.
there. But I
Yep.
can't tell here. It and even when I was playing with the fine tune, it was still hard to tell. So
It's
it could just be this poetic.
yes. So and so if that nucleus was in fact fully connected there, as Melissa just pointed out, that's a dyspoetic figure to see, right? So that kind of points to some kind of issue in the marrow.
That
Uh,
that would be kind of surprising though, because even when you have ALL, usually the neutrophils are not impacted.
not affected, right?
I
Yep.
think toxic granulation would be more likely because stress on the
Yeah,
neutrophils.
true.
I don't know.
And the nucleus, and if I'm being honest too, the nucleus pattern looks like a toxic gran
Yeah.
nucleus might look too. It's mature, but it's not fully like, neutrophil mature. So that's plausible. But still, this is interesting.
Hmm.
Lymphocyte,
He
nothing
looks
crazy.
relatively normal too. I mean, he looks a
Yep.
little bit more excited than a small round resting, but he's not reactive yet.
Yep. So Melissa's noting that darker blue kind of outline, but I think both of us would agree that though there are reactive features, it is not a reactive cell yet, at least one that needs to be enumerated as such.
He's not resting, but he's sort of awake and a little bit irritated.
I hate to say this. Is he woke, Melissa? Oh boy, never mind, Dave. Don't go down that path.
Yeah, look at this guy.
Yeah,
Yeah, I think they're just toxic granules.
that is weird. All
It's
right.
really funky looking. Like this thing here, I think that's just piece of the nucleus kind of jetting out, but it's like you look at it and it almost looks like a big granule.
So I thought I saw a couple of cells that were granulocyte-ish on lower power that had a piece of nucleus that was kind of detached. So that's definitely something I want to pay attention to as
Hmm.
well. Yeah, really strange. Other things that could give us those toxic like granules, right? So maybe we think about things like Riley bodies or something. What do you think about the possibility there? If there was an elder Riley or some kind of mucopolysaccharidosis, we would see it along all cells, correct? So we want to be careful. But I think that's not a bad thing to at least have kind of in your mind,
Yeah,
right?
yeah.
Uh,
Definitely rare,
very, very rare. Yep.
but could be. This one's probably not, but
Right. Right. And we have a broken EO, which is pretty common to see in terms of EOs. Yeah.
yeah, the neutrophils are definitely stressed out.
Mm-hmm. Yeah. They actually almost look like there's an infection, don't they? So one of the things I look for with neutrophils, we look for toxic gran, vacuolation, Dole bodies, but there's like a ruggedness. They can just look like they've been through war, is one of the other kind of turns of phrase I use. And that this one looks a little shaggy, a little rough, the one
So
on the
this is
right.
the neutrophil we're talking about, and
Yes.
then that's an EO.
An EO. Yep. Yeah, this is a puzzling slide. And yeah, at this point, I think I'm committing to that just being the toxic gram for
Yeah, I
this
think
patient.
so too. This guy up here, I think it's just a squished EO.
It is, but I think it's worth noting the nucleus is not like segmented or anything. It does look quite clumped. I'm gonna chalk this one up to just some mistakes were made. um, because part of these degranulated EOs might still feed into the fact that there's just an increased stimulated production. So I think that's where we're at with these, but that is very weird.
Yeah, well,
To,
I
to
think it's smudged.
yeah, yeah,
I don't think it's a whole cell. That's why I was looking at the site. I was trying to see if
okay,
there's cytoplasm, and I think it's just a big smooge.
okay,
But it was an
yeah,
EO,
I'll buy that.
and we can tell because of the granules.
Yeah,
Another beat up toxic granulated neutrophil.
mm-hmm. And that lymph is very basophilic. Um, but again, a lot of things to indicate reactive process here.
Yeah.
I mean, so yeah, this is a really puzzling slide.
Yeah, between the lymphocytes and the eosinophils, like this is an eosinophil that just pulled into the screen here. It's just really hypogranular.
Very much so. So now those patterns are developing.
Yeah.
But yeah, the eosinophilia, the toxic gran-ish features, those basophilia and the lymphs. This person's got an infection or a hypersensitivity or something, right? Yeah. Hmm.
That one's kind of funky. That's an EO. Kind of funky
I
looking.
agree.
Oh, let's go a little bit thick.
Sure.
Another toxic gran.
Yeah. Yeah, there's a lot of hypogranular EOs. So much so I think I'd make a comment, procedure allowing. I would definitely want to note that.
Yeah, well, I think it also depends because if there's a lot of EOs too, it might be something that we might leave for path review, depending on how
Yeah,
many eosinophils there are.
very good point. And I think there was there was a really particular point in our history where our heme path said, "Hey, this many EOs, like I want to look at that," right?
Yeah.
And yeah,
It could be
EOs are kind of
nothing.
hot right now.
Yeah, it could be nothing, but it could be something.
Yes, yes. Oh, really cool. So this appears to be like a necrotic or pycnotic neutrophil here. Pretty neat. Usually rare to see these in a fresh peripheral blood. Uh,
Yeah. So what is a pycnotic cell?
yeah, so pycnosis is a normal biological process where a cell is programmed to die, right? So um, many of the hematopoietic cells too, actually, right, have really fast kind of turnover rates, the neutrophil being one of them. But typically these get removed or they pycnose in a compartment, thinking of the spleen and places like that. So a little rare to see it kind of circulating. And it would be termed necrotic if it died for, perhaps like you can start to see these when a blood is a day old, a week old, right? As the amount of glucose and nutrients in the sample degrade, cells will just kind of like die. Um,
Yeah, or
but
if
yeah,
you're thinking about it like in the body rather than in the tube, I think
sure.
you're gonna have the pycnosis or apoptosis happening normally. That's what we want our cells to do. Whereas necrosis, think
Yeah,
like I'm a neutrophil, I'm fighting an infection in the tissues, and I basically am done and I just kind of pop and explode and you're releasing all of your contents into the area and causing damage to the area.
very
So
good point.
necrosis causes damage to the surrounding area, whereas apoptosis or our pycnotic cells do not.
Right. Yeah. So that it's a controlled demolition. Yeah. So think of pycnosis as a normal uh, safe process. So that cell is clearly pycnotic, necrotic. Then there's that little thing to the left of it. Yeah. And then further off screen here, is that a nucleated red blood cell? Or is that just artifacts? Hard to tell, huh?
I think it's just a stray nucleus.
Yeah.
A little one, obviously.
Little- So that's a little strange, and that's got me kind of thinking a little bit here too. So I would look at this patient's CBC and kind of assess the degree of anemia that may be here. Remember initially I said, hey, we might have like maybe an IDA or something. You usually don't see nucleated red cells or extruded nuclei from NRBCs just willy-nilly.
Well, also just looking at it closer, this hypochromia is probably false
Artifacts. Yeah.
because of all the watermarks that we're seeing on all of the hypochromic cells.
Yep.
So the
So I initially saw what I thought are large central pallor, but if we look at a lot of these central pallor, I'm bringing up my annotation stuff here. Like even the cell, for example, you normally don't have an abrupt change from like um, uh, hemoglobin to not hemoglobin. It's usually kind of a gradual. And then what Melissa was just pointing out is like on these cells, um, and there's a lot of them. I'm not going to circle all of them, but there are these drying artifacts, which we can see happen in slides. And if you adjust that fine focus, thank you, they'll turn like black, right? As you get to that full refractory kind of, so that's just artifacts. So it would appear a lot of these central pallor are unreliable and it's just staining issues. So yeah, I can back away from uh, the hypochromia a little bit. But I would certainly still be looking at the red cell indices because I don't like an NRBC or an extruded nucleus from an NRBC to be in a normal patient. And NRBCs would not be something I'd associate with like a low-grade anemia in normal circumstances.
Mm-hmm.
So there's been a couple of little elements here that I think like are, I don't want to say troubling, but for someone who's experienced as we are, this is something strange that's happening.
Mm-hmm.
But man, it doesn't look like I wouldn't be like, this is an ALL.
No, definitely not.
See, and then a lot of vacuolization. I mean, I would super buy. Oh wait, is this an EO?
Yeah.
Are those vacuoles?
Yeah.
Wow. So EOs are fully capable of phagocytosis, but that's very unusual.
I wonder too if it's starting the process of autophagocytosis.
Mm.
Usually when
So
you have a lot of little vacuoles like that, it's more of an autophagocytosis than like a normal phagocytosis, where you think of it ingesting like a bacteria or something.
foreign stuff, yeah. Yeah, so the definitely seems to be some degree of like immune dysregulation or something kind of popping up here.
Yeah. Well, and if there's immune dysregulation in that we're already stimulating way too many eosinophils, who's
True.
to say that there's nothing stimulating these eosinophils to not go through apoptosis?
True. Very good, right? So um so Melissa's pointing out that there's an increased number. So one of the things we think about is proliferating, right? But what if there was some kind of process standing in the way of turning the cells over and they're living for far longer than they should be living? That's a great point. Um,
I
yeah,
don't
so
know that that's true. That's
no,
just
but it's something
oh
to think about
yeah,
conceptually.
yeah, yeah.
So when it comes to leukemias, there's some of them we have these recurrent cytogenetic abnormalities. So a really small lymphocyte there, huh? But
Yeah, but
very
I think it's a nice small round resting because look
yep,
at the red cells around them.
yep, yep, and deeply basophilic. Noting that too. But with a lot of like leukemias and things like that, you know, there's an uncontrolled proliferation, but there's usually an element of evading apoptosis when they should be apoptosing. So it's a good
It's
concept to
usually
think
the
about.
malignant cells, though. The EOs are
Right.
not malignant here, but there are certain cytokines that can
Yep.
stimulate basophils to live longer. Maybe there's something with eosinophils also.
Right.
Don't know. Hey, this lymphocyte looks interesting because you can see that prominent nucleoli.
Can.
But again, just in the setting, I wouldn't
I
think
wouldn't even
anything
think
of it.
twice.
No.
Yeah. I'm like, I gotta, being totally straightforward. I 100% would probably be bought into a reactive
Yeah.
kind of thing, be it a hypersensitivity or an infection. Yeah.
So,
So it's a neutrophil, yep. And
um, let's come over here.
I still continue to be puzzled by those granules.
Hmm. They don't look like granules though. They're
I
too small.
I know, but it's just to me they don't feel like neutrophil granules either. That's the thing that's bugging me. Um, and I suppose the color's not quite right for a basophil too. See, and then that's a more normal looking toxic gran in that middle neutrophil.
Yeah, but you're right. This just looks reactive for some
Yeah.
with some kind of eosinophilia.
Yep. How bizarre. And I suppose I don't see it very much, but when we think about eosinophils and their sir, you got any granules to spare, sir? Like there's nothing in that. There's just this little pocket of granules in that EO and like a sparse on the left there.
Yeah. This guy
And
here too is kind of sparse here.
I feel like I would be asking for the path to look at this
Yeah.
For sure. Even irrespective of an EO count review rule. Yeah.
Yeah, but that's also a good practice. Just because there's not a rule for it, if your intuition and Dave and I have always said when we're teaching, a student may say, "Well, why?" Sometimes it's my gut tells me that.
Yeah.
So
Yeah.
if you have that gut feeling, it's always a good thing to have somebody else look at it. It's never a bad thing to ask for a second opinion.
So true. I mean, so for working techs, this will be a pretty common concept, but for our students, once you get past all these assessments and you pass the really important tests that you're supposed to pass, it really should be a team environment. I really want to stress Heme Lab should operate with, throw pride and things to the side and engage with your peers. And, I think the best labs to work in are ones where there's very, very collaborative and, So ask for a second set of eyes always if something weird is happening.
And the pathologist can always look at it. And I mean, even sometimes the hemonc docs are in and out of the lab looking at slides too.
Yes. We were really lucky at the institution we worked at to have those kinds of exposures. Yeah.
Let's see a couple more, see if we find anything else.
Mhm. Yeah, because I mean the lymphs, I expected to see, something kind of weird, but what is that just an empty? Yeah. Never mind. Sorry.
Empty space.
Yeah. It's just empty.
Yeah. Yeah.
I wanted to make sure it wasn't an inclusion at first glance.
Okay. Let me focus that a little bit better.
Yeah, I guess that this cell kind of tells the story. EOs, hypogranulation, strange granulation in our neutrophils, and then the occasional reactive looking kind of lymph maybe, but
not reactive limbs, but the limbs don't look pleased.
Yes.
They look like they're slightly irritated.
So yeah, this was a pretty cool learning experience.
Yeah. And so, looking at something like this, you have just eosinophilia, really, with look like a reactive process. So, the physician is going to have to look at it and say, well, is this a neoplasm related thing like ALL with hypereosinophilia, which it was, or is it something else?
Mm-hmm. Yeah, my guess with someone who's younger, they'd probably be working up for all sorts of different allergic and hey, eosinophils known to be in helminth kind of infections and things like that. That would probably be the story I tell myself is probably most likely.
Yeah.
That explains some of the weird reactivity from some of the other, right? And so yeah, this is a really fascinating case. So this was found to be an ALL, is that correct?
Yep. Yeah, so really it's the bone marrow that's going to tell you the story. So the bone marrow will show the blasts with all of the developing eosinophils as well. So, not just the malignant population taking over the marrow, but also this developing eosinophilic population really having that expansion in the marrow in addition to that clonal malignant population. Mm-hmm. Which then makes it even more interesting that there's not a severe thrombocytopenia with it.
I know. Yeah. Wish I had the bone marrow.
I know, me too. I don't have that. All right. Well, I think that's all we have for this slide. So thanks for watching.
Thanks for your time. Please like, subscribe, and hit the bell if you'd like notifications whenever we post a new video. And feel free to reach out to us on social media or via email with comments or suggestions about future content. Thanks.